Thank you, Chair Munoz. Vice Chair.
Striking nurses filled Hearing Room D at the Oregon State Capitol. They came to support House Bill 2792. The legislation is designed to force hospitals to publicly disclose how much they pay replacement workers during a strike. Providence is currently paying thousands of replacement nurses as the medical group enters week 5 of strike negotiations with the Oregon Nurses Association. Providence will not disclose how much those workers are costing them to the public or to KGW. ONA doesn't like that.
This bill is about ensuring that Oregon's hospitals are upholding their obligations as public serving institutions.
Quick pause here. She said public serving institution. That's different than a public institution. Many hospitals, including Providence, are privately owned and under no obligation to disclose such things.
This bill is about ensuring that we, as a state, are not allowing our healthcare systems to be manipulated into a tool for union busting behind financial secrecy.
But is this bill simply a tool for striking union workers? The Hospital Association of Oregon seems to think so.
We've had other bills and other conversations around transparency. This bill doesn't accomplish that. This is a negotiating tool.
I started working on this bill before the Providence strike even happened.
Representative Travis Nelson, also a registered nurse, introduced the bill. For him, it's about transparency. He says from where the institution gets its funding is more important than whether it's public or private regarding this kind of disclosure.
Our state spends a tremendous amount of public dollars on Medicaid, a huge chunk of which goes to our hospitals. And so if hospitals are going to take that much in public dollars that you and I work hard for, then they should have to tell us where they're spending that money.
Most hospitals do disclose their financials, including Providence. You can look them up online. But this bill is asking for a single line item for strike replacements. And for some lawmakers listening to both sides, that points back to the strike.
I'm a fan of nursing, but it's a negotiation. So negotiate. But I don't know what this bill does, and I still don't know how this helps put our frontline workers back to work so that then the hospital can save money, because it is extremely expensive when we strike.
It's now up to the chair of the House Committee of Labor and Workplace Standards to call a vote on the bill. If that happens and it makes it through, the next step is the House floor. In Salem, Catherine Cook, KGW News.